November is Men's Health Awareness Month, when we raise awareness and provide educational opportunities for men's health issues. According to the American Cancer Society, the most prevalent type of cancer in men in 2024 is prostate cancer. The incidence rate has increased annually over the past decade. Testicular cancer is less common, but has increased as well. Thanks for joining us for this week's Health News You Can Use. I'm Dan Cohen. Joining us today is Dr. Ryan Miller of Advanced Urologic Associates at St. Luke's East Hospital. Dr. Miller, thanks for joining us during Men's Health Awareness Month.
Thank you for having me.
So I want to start with our conversation about prostate cancer and screening guidelines and risk factors. What do folks need to know about all of those?
Well, prostate cancer screening typically begins at age 45 for those of average risk. A baseline PSA is recommended between 45 and 50, and then annually thereafter until around age 74. For those of increased risk, which would include those patients who have a family history of prostate cancer, a first-degree relative, those of Black ancestry, and also those who have some more rare genetic predispositions, prostate cancer screening would begin at age 40, between 40 and 45. For those folks. So those are really the recommendations at present.
And what are some of the myths about prostate cancer that you've heard from some of your patients and those in the community?
So I think there's really kind of four myths I'd highlight briefly. One of those is that there are symptoms associated with prostate cancer. By and large, most men don't have any symptoms associated with it. So just because there's no symptoms or change in urinary patterns and those sorts of things doesn't necessarily mean that cancer couldn't be present. And so screening, therefore, of course, should take place with a PSA and a digital rectal exam to rule out prostate cancer. The second would be that PSA is of no value, and I think that stems from a recommendation by the United States Preventive Task Force a few years ago that gave PSA screening a low rating. Thereafter, we saw an influx of higher grade prostate cancers, and so they switched it to a higher grade, and so really PSA has been shown to be of value and has decreased the incidence of prostate cancer mortality. The third would be that if a biopsy is recommended to evaluate an abnormal PSA, that could spread cancer if there's cancer present. And the studies have clearly shown that that's not the case. So if a biopsy is recommended, I would not have that concern. And then lastly, which is a little bit more obscure, but there is a myth out there that vasectomy potentially would lead to an increased risk of prostate cancer, and that also has been shown to be untrue. So,
and now moving to testicular cancer, what are the recommended screening guidelines for that?
Well, testicular cancer is most common really between ages of 15 and 35. And so for those patients, they would want to do a monthly self-exam. Typically in the shower is a good time to do that and just examine the testicles themselves. And if there's something that they feel that doesn't seem right or whatnot, then bring it to the attention of a healthcare professional so that they can get the proper evaluation. So that's really the main screening recommendation for testis cancer.
And advancements for prostate cancer treatment, I know those are being performed at AUA in your office. What are you seeing there?
Yeah, I think really probably the biggest thing that's happened over the last several years is just the advent of robotic surgery. And so robotic surgery is just a way of performing laparoscopic procedures with a robotic platform. And that's really improved things like blood loss during surgeries and convalescence time after surgery, which is just the amount of time spent in the hospital. Patients are going home a lot earlier than they used to after robotic surgery. And then secondly, I would just highlight there's a procedure that we can do prior to radiation treatment for prostate cancer to help protect the rectum. It's an insertion of a little water-based gel between the prostate and the rectum, protect the rectum, and help reduce any rectal irritation afterwards. So we've been able to kind of help our radiation colleagues, in that way as well. So,
and what advancements are you seeing on the horizon to help treat prostate cancer?
I think the biggest thing, and this is kind of a buzzword out there nowadays, is AI, right? So AI is being used in a lot of different realms of our lives, and we'll have a lot of application, I think, in medicine going forward. And one example would just be, a recent study where they used AI to evaluate prostate tumors on MRI for patients who had known prostate cancer, and AI was able to predict with pretty good accuracy, kind of the aggressiveness of the tumor and those sorts of things. So that would help us direct treatment for those patients in the future. So it hasn't quite reached us yet, but I think that's one of those things that soon will become commonplace in our profession, is using AI to help us diagnose and also prescribe treatment for various things.
Terrific. What else do you want to add on these topics?
Well, I think, the biggest thing would be both these cancers, prostate cancer and testicular cancer, are highly treatable and oftentimes curable.
Yeah.
And so with proper screening, if we can identify them early on, then people have a very good chance of beating them. And so that would just again, highlight, making sure you're doing the proper screenings. And I think, obviously these are sensitive areas of the body and people are a little bit reluctant to talk about them, especially men, right?
Sure.
And so, just trying to put aside any embarrassment or fears that may be associated with it, and understanding that we're all healthcare professionals and have your best interest at hand, so that we can do the screenings that we need to do to detect these things early. And finally, I would just say, it's always good to keep lines of communication open with our kids, between parents and mentors and kids. So this is no different, right? So if they discover something that doesn't feel quite right, they feel comfortable coming to us and letting us know about it, so that, again, the proper evaluation can be performed. So that would be the other thing, is just trying to establish just good open lines of communications with our kids too.
Wonderful advice for everybody. Thank you, Dr. Miller, for joining us. We really appreciate it.
You're welcome.
To learn more or schedule a consultation, visit stlukeskc.org/AUA. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.